we delve into the life of a young bipolar patient and catch up with psychiatrist Dr. Shae and get up to date with the latest bipolar treatment.
Alan, the food is ready.
I've been diagnosed with bipolar disorder, and I guess it makes sense because it's very debilitating sometimes. I mean, some days you're on top of the world, you just want to run around, you buy things you don't even need, spend like $200 on shopping sprees, and then some other days you're just so depressed, don't really know what to do with yourself.
Alan, you change a lot, and I don't know what to do anymore.
Dr. Waal is a psychiatrist who is currently researching the latest bipolar treatments.
So can you briefly describe for us what bipolar involves?
So bipolar is a mood or affective disorder characterised by extreme mood swings in a patient's personality, which are both the elevated or manic phase and the depressive phase. But it can be further categorised into two groups. Bipolar 1, which is defined as one or more lifetime episodes of mania and usually attacks of depression. And bipolar 2, which is episodes of both hypomania and depression, but no manic episodes.
What drugs are currently approved for the use of treatment of bipolar?
Lorazepam, quetiapine, and olanzapine fluoxetine combination therapy are the drugs currently approved by the FDA in the treatment of bipolar depression.
And how do these drugs work in relieving the symptoms of bipolar?
The newest drug on the market for the treatment of bipolar disorder is lorazepam. Its mechanism of action isn't entirely known, but it is thought that the drug is a dopamine, D2, and serotonin 5-HT2A receptor antagonist. It also has moderate antagonistic activity on the alpha 2C and 2A adrenergic receptors. The classical atypical antipsychotic prescribed for bipolar disorder is quetiapine. Quetiapine has significant antidepressant activity in the depressive stage of bipolar disorder. It has antagonistic action on the 5-HT1A, 5-HT2, D1, D2, histamine 1, and alpha 1 and 2 receptor sites in the brain. Olanzapine fluoxetine combines an atypical antipsychotic with a selective serotonin reuptake inhibitor to restore neurotransmitter balance in the brain, particularly levels of serotonin, dopamine, and norepinephrine. The antipsychotic effects of olanzapine are due to its antagonist action on the serotonin, 5-HT2A, and dopamine D2 receptor sites.
Are there any side effects of these drugs?
Quetiapine has side effects including dry mouth, gastrointestinal upset, and dizziness. The side effects of olanzapine fluoxetine include dizziness, drowsiness, diarrhea, dry mouth, and increased weight gain because of increased appetite. Side effects associated with lorazepam include weight gain, akathisia, nausea, sedation, and Parkinsonian symptoms.
So it seems each drug has their own respective side effects. With this in mind, what are the advantages of one drug over another, and which do you believe is the most beneficial drug on the market?
Based on current research, lorazepam has been found to be the most advantageous of the three drugs. This is because it has fewer side effects than conventional antipsychotics and also lower drug-to-drug interactions, and therefore it can be used as an adjunct therapy. Quetiapine has fewer extrapyramidal side effects, so it may be useful for patients who are displaying Parkinsonian-like symptoms from other drugs. It is also effective against both the positive and the negative symptoms of bipolar disorder, whereas the other drugs are more effective against the depressive symptoms. Olanzapine fluoxetine combination therapy is associated with fewer extrapyramidal side effects. It also has been found to have better efficacy against the depressive symptoms of bipolar disorder as opposed to monotherapy antipsychotics. Consideration does have to be taken into account regarding the weight gain that can be associated with olanzapine fluoxetine therapy. Overall, lorazepam is the first-line treatment in most situations, as it does have fewer side effects and drug-to-drug interactions.
Next week, tune in for our feature on schizophrenia.